This is Ben Trump doing a presentation on problem-based learning for Nursing 322 at the PA College of Nursing and Health Sciences. Problem-based learning, sometimes referred to or identified as PBL, is a form, according to the Bastable text, of cooperative or team-based learning. It was actually created in the 1960s by Howard Burroughs. He was a faculty member at McMaster Medical School in Canada, and he saw that there was a knowledge gap between what medical students were learning in the classroom and then being able to relate that to clinical applications. This is similar to what most of us would have gone through in the form of sim labs or case study scenarios throughout nursing school. Problem-based learning is sort of an overarching type of learning, with sim or case-based scenarios being like subsets of problem-based learning. So in problem-based learning, it's unique because learning is actually student-centered, so it actually is a step away from that sort of traditional classroom lecture. The focus is on engaging students in the learning process and having them take a more active role as compared to sitting in that traditional lecture classroom environment. Teachers act more as facilitators rather than the authoritative or administrative type person, and they assist learning through asking probing questions of the students. Answers are not directly given, but it's that they sort of push students in the right direction to figure out a problem. And as students work in small groups of anywhere between 3 to 8 people, and they are first and foremost presented with a problem or scenario that they need to come up with a solution for. And typically it's a very complex solution. Problem-based learning is unique that it has 6 specific characteristics to it, and they're listed here. So typically there is a problem which is identified. It is then presented in this real life, you could say like a clinical-based type scenario or case study. And as students are presented with this problem, they need to draw on their current knowledge in order to come up with a solution. And it's unique that there's not just one solution, a right or a wrong answer to it, but it could be a multitude of answers to it, and that's what's unique about problem-based learning, that it really focuses on students to draw out that knowledge that they currently have, and then as points 4 and 5 show, that invariably there's going to be areas of inadequate knowledge or knowledge gaps, and in order to solve this solution that they're presented with, they need to essentially research or increase their knowledge base. And then at the end, learning is found as the solution or solutions are formulated to solve this said problem. And I have a quick little video just to watch, which is an explanation on problem-based learning.
Mrs. Jones is a teacher and wants to introduce problem-based learning into her classroom. This is how she does it. The teacher or facilitator breaks the class up into small groups and presents them a problem. The two most common problem-based learning activities are case study and simulation of real life scenarios. Once the activity is presented, the group works towards identifying the problem. The group uses their pre-existing knowledge to try to generate possible solutions. This helps to identify their learning needs or knowledge that is lacking but is needed to come to a solution. This is when the group breaks off for self-study to research and gain new knowledge. The group then reconvenes and evaluates the problem by applying the new knowledge. They then present an assessment on the problem and reflect on their learning. It is important to note that without clear objectives and good facilitation, students can be lost as to how they are to engage in problem-based learning.
Problem-based learning also covers the domains of the cognitive domain as well as the affective domain. Specifically in the cognitive domain, and as we read in our FastAble text for this week, cognitive domain is that thinking domain. So overarchingly, that this is all this cognitive or thought process work being done. And I laid this out because it's similar to the example on page 434 in our textbooks, which shows that in order for this to even take place, there needs to be that baseline knowledge. And then as students go through and attempt to solve these problems, there is a component of comprehension. They need to apply what they currently know to the current or scenario that they have been given. And then as they formulate those responses or possible solutions, they're doing the analysis, synthesis, and then at the end, as they get together as a whole big classroom and talk about the solutions, there is that form of evaluation as well. As I had said, the affective domain is covered, and these different areas of the triangle here are similar to what you would have also seen in your textbook on page 435. The last one at the top, the internalizing values, only differs because FastAble text actually says that this is the characterization stage. And on the right-hand side of this screen, you can see where these different areas of the affective domain are actually covered. So the responding is covered as the class breaks into those small groups and has to formulate these new questions or ideas. As they sort of bring all these things to the table and hash it out, so to speak, through their group, they're sharing their different perspectives while valuing the possible solutions. However, one might deem one, oh yeah, I didn't think about that, or another person of, oh hey, that's a great idea because I wouldn't even thought about that unless somebody else brought it to the table, so to speak. And then just a quick word that problem-based learning can also include the psychomotor standpoint of domain. I chose not to specifically cover that only because typically that would have been covered in those other students who have covered the case-based scenarios or simulations and such. But again, because they're sort of subsets of problem-based learning, those would also be included. Some pros and cons of problem-based learning. As we just covered in the past two slides, because there are multiple domains of learning and those hierarchies which are covered through the cognitive domain, problem-based learning is more superior to that traditional classroom lecture because there's greater comprehension and application. There is more active and immediate feedback as that teaching and learning process takes place, and that's both by the students engaging in one another as well as the teacher leading them through and towards a solution. It teaches students to become more lifelong learners because they learn how to do that research on their own as compared to being just spoon-fed. Also with their problem-solving skills, that sort of goes along with the research component to it. And then the biggest take-home point is that based on knowledge, that students can then transfer that and apply that to similar but not the same, again, not fitting a cookie cutter type thing, situation. So we'll cover a few of those in the next slide or two. Some cons, though, are that for those who are not self-motivated, this is very difficult. Those concepts such as like math or psychology where there is a very abstract type answer or where there's not multiple solutions, this problem-based learning doesn't work. For example, math, 2 plus 2 always equals 4. There can't be multiple solutions to that, there's just one solution. And this is very, very time intensive. It takes a lot of time to make these scenarios up, and then also just to have this foundational knowledge to do the research, the application, so on and so forth. So we'll just quickly cover 3 scenarios which are specific to problem-based learning. One which is specific to the unit I work in, we had a high degree of falls on our unit, so we were tasked with the problem of how can falls be prevented. as a unit, we needed to gather information on who our fall population was, and then based on that, how can we prevent falls? So we did this whole work, so to speak, on coming up with a fall risk, utilizing our fall blankets, and then actually following through with those said things on how to prevent falls. For patient teaching, the bottom way, ways to prevent hyperglycemia, this could be a conversation that you have with a patient in order to explain ways in how to prevent hyperglycemic episodes, instructing patients on the effects of sugar or high carbohydrate foods, what soft drinks have in them and why they're not the best choice on a consistent basis for glycemic control, what infections do to somebody and how it affects their blood sugars. And then you could present them with a problem, so to speak, on, well, how can you help control your hyperglycemia? And then some of that is education and or information gathering from the patient on high protein foods, high fiber foods, and the importance of drinking plenty of water. And our last scenario, our case study of an ill 53-year-old gentleman, is probably something that you may have seen or recognized more from the nursing type school that we've gone through. And that would be an example of a gentleman who comes to the emergency department with a 3-day history of generalized malaise, weakness, chills and shakes, nauseousness, vomiting of blood, weight gain, and itchy skin. And these are all very generalized complaints, but you can help lead the students by solving this problem of how comes, though he is not on any blood thinners, he has an elevated PT-INR. So the students would do some research on these very generalized symptoms and try to come up with solutions. Some solutions might be that he has a GI bug, a type of infection. They would be asking questions of, does he have any fever? How about heart problems? To which then the facilitator can lead people on saying that no, his only history is that he has hypertension, but he is a chronic alcoholic. And then as we lead people through this learning process, the end solution could be that, hey, he has a liver failure diagnosis. Hence, why he would have the weight gain because of ascites, his ammonia level would be increased, therefore the itchy skin, and because his liver is not metabolizing appropriately and such, that would lead to his increased PT-INR. So, as you can see, the teaching learning process that occurs through problem-based learning is very familiar to those of us who have gone through nursing school, and hopefully that you can understand a little bit more about problem-based learning after this scenario. Thank you very much.